Welcome to Lasting Lifestyles, a support program for caregivers and families. Hello, I'm Janet Corbally, Director of Viebridge Connections, and I'm so pleased to have joining me Dr. Alan Nasar, who's an orthopedic surgeon. Welcome, Dr. Nasar.
Good morning, Janet.
Dr. Nasar, you deal with many different conditions coming in, people coming to you for support and help, but one particular is joint replacement surgery. I'm sure you deal with quite often. And I'd like to talk about some of the advances in joint replacement surgery because you hear it so often out there that people are pursuing this. What exactly is joint replacement surgery?
Joint replacement surgery is involves the hip, the knee, the shoulder, and there are other joints as well, but those are the larger joints that are replaced. And it's a treatment for arthritis or damage to the cartilage and the bones in your joint. So once a patient has pain, stiffness, grinding, limitation of activity from the arthritis in their joints, joint replacement is an excellent option. It removes the cartilage and shaves off the edges of the bone and replaces those surfaces with metal and plastic artificial joints, which can then function like the original joint that's being replaced.
It sounds like it's definitely improving quality of life, and when you're dealing with pain, to try and relieve some of that. Now, it just sounds so involved. I mean, how are these procedures done?
Well, there are a lot of different procedures, but let's take the knee. That's the most common joint that's replaced. It's done by opening up the knee. It's a surgical incision. We've shrunk down the size of the surgery now, and we can do it through a minimally invasive approach, which basically means not cutting as much skin and not cutting as much tissue underneath. And then, using power tools, essentially, the bone is reshaped so that it fits exactly with the new components. The artificial joints have to fit tightly, and they're glued with bone cement into place. There's some balancing, and the cuts have to be done in a very precise fashion. And then the patient will have a good, improved range of motion and much less pain, and can return to their activities that they like to do.
It's like rebuilding that part of the body. It's amazing. So there is a real difference between the traditional surgery versus the minimally invasive surgery, obviously, for improving quality.
Yeah, the main differences that we've seen is that with the smaller incision, and newer pain management treatments as well, which is something that's coming in, people are focusing more on now. Patients recover faster, have less pain, less blood loss, less stiffness, overall a more comfortable experience, and can return to their work or pleasure activities, more quickly.
Which is very important,
I think that's their biggest fear. Patients' biggest fear with joint replacement is, I'm going to be in pain and I'm going to be laid up for months. And luckily, that's not the case anymore.
But there is some follow-up therapy that's usually
Absolutely.
involved after?
Most patients do require about a month or even more of physical therapy, maybe 2 to 3 times a week, especially for knees, to get the most out of their surgery.
Now, how long, if I had joint replacement, we'll use the knee as the example, how long will that last? I mean, is it something that I will possibly have to have done again?
Yeah, possibly. It depends on your age and your activity level. I tell patients it's like a set of tires. A tire is going to be good for, let's say, 60,000 miles. Obviously, if you drive hard and fast,
True.
you could wear it out sooner. So with the new technology that's out there, our knee replacements we expect can last about 20 years. So at some point, you can outlive your knee replacement, and you might need to have sort of a tune-up or a tire change. Okay. The whole thing would not need to be changed, but just the wearing parts. So in this case, there's a polyethylene or a plastic type component in the knee replacement that would have to be changed if it wears out.
Now, is joint replacement surgery something that is just primarily done on older adults, or do younger individuals have this? done as well?
Traditionally it was reserved for 65 and older patients, but now with the newer technology, the minimally invasive surgery, and the newer equipment that, especially for hips, can last even longer, maybe even 30 years, we're doing joint replacements on 50-year-olds, 60-year-olds, even in some cases on 20-year-olds, if the disease is that severe that they need it.
Oh my goodness! So you don't even think about it, a 20-year-old. But then again, it's what it is that's going on within.
I've known some 20-year-olds who were in severe, agonizing pain, could not get around, could not do their job, and they've had, for instance, a hip replacement surgery, and they're very appreciative. They get their quality of life back, and it's very important.
Quality of life is what really counts. What are the recent advances in prosthetic design when you're talking about joint replacement?
For the hip, there have been some excellent recent advances. We use now, the traditional surfaces were cobalt chrome and the polyethylene plastic, which tended to wear in about 10 to 20 years. There was you could measure it every year, a certain amount would be worn. With the newer components, ceramic on ceramic, metal on metal, there is virtually no wear. So on the wear simulators, it looks like these things will last, forever, as far as a patient's lifespan is concerned. We don't have 20 or 30 years follow-up yet, though, so we can't be certain. But what we do know is that they will last longer than the previous technology, and that's very exciting. So when I put a hip replacement in a 50-year-old, I can tell them this probably will last you, if things go well, the rest of your life. And that's what patients want to hear. They want to be coming back for repeat surgeries every few years.
Well, who wants to do that? And we just want to keep moving, and we just. Again, quality of life means so much. Does the patient get to choose their prosthetic joint?
That's a very good question. And, it's usually the surgeon is the one who decides, and he should look, the orthopedic surgeon should look at the picture, look at the patient. For instance, you may not want to use metal on metal in a patient and a woman of childbearing age because there's some ions that could be released. So, with the help of the physician, and the patient should have some input into the process, they can choose what implant is best for that particular patient.
It's amazing you could even be